Hi, welcome to the first installment of CCRM TV. My name is Dr. Brian Levine, and I'm the practice director of CCRM New York in Midtown Manhattan. It's almost nearly impossible to turn on the television, read a newspaper, or talk to your doctor without someone mentioning COVID-19 or coronavirus. We know as fertility experts and providers of reproductive health care that COVID-19 is a large source of stress and anxiety for our patients. Right now, there's a lot of ambiguity about who can get pregnant, when to get pregnant, and what are the effects of COVID-19 on pregnancy. You, our followers on our social media channels, as well as our patients in our clinics at our 11 sites all across the country, have done an incredible job at sending us questions throughout the night. We're going to respond to your questions and help you understand what you can do and what it means for today's reproductive health choices surrounding COVID-19. Like a good doctor, I've made all my notes here on my chart, and I'm going to go through them one by one. Please feel free to reach out to us if something is not clear, or if you have any ambiguity about any of the statements that we're making. And of course, we always recommend that you reach out to your doctor if you already have one at CCRM. And if you don't have a doctor at CCRM, please go to our website, which you can find below, to help set yourself up with the CCRM network of physicians to find a physician at the network that's closest to where you live. The first question that we're going to address is, how long do you expect fertility treatments to be postponed? 2, 3, 6 months, maybe a year? This question is referencing the American Society of Reproductive Medicine, or ASRM's guidelines that were released last week on the 17th of March. As part of these guidelines, it said that we are going to take a pause right now on treating patients who are trying to get pregnant, and we're going to focus on only freezing or cryopreserving embryos and not doing embryo transfers or intrauterine inseminations at this time. It did not say we are stopping. It did say that there is a lack of information about the effects of COVID-19 on women who are trying to get pregnant. And so we're taking a 2-week pause to help better understand the impact of COVID-19 on the reproductive choices that patients and providers are making. So I would say at this point right now, this is not something to worry about in terms of months, but you should talk to your physician and ask them next week, the last week of March, to say, what did ASRM tell you? Because on the 30th of March, the guidelines are going to be revised. Next question, when will cycles realistically start again? For those who are furloughed or laid off, it's been very hard to plan. As employers and providers and employees, we completely understand the financial stress and strain that so many of you are under. At this time, we cannot tell you reliably when we're going to be able to restart IVF cycles. Of course, all the patients that are currently in treatment, we're doing everything we can to make sure that they do get to their goal of getting to egg retrieval. But in terms of starting new cycles, we just don't know. Again, ASRM will give us guidelines on the 30th of March, and we'll be sure to get those out to our patients upon receipt. Do we have any insights into when a frozen embryo transfer can expect to happen? There's a current patient and a bunch of patients who are in a holding pattern. This is the most frustrating, because one of the actions that we took in our clinic, and I know many other clinics across the country did, even outside of the CCRM network, is that we said, let's pause specifically on getting people pregnant at this time. Many of us canceled patients who were in the middle of a frozen embryo transfer cycle, patients who have a gestational carrier who was almost ready to go, those cycles were potentially canceled. And to feel like you're so close to that end zone and to that goal of getting pregnant and then to have it stopped feels really tough, and we understand that. However, we didn't tell anyone that we're not doing transfers. What we said is we're just pausing right now. So realistically, we'll have better insight next week, and I really do look forward to updating you and updating our patients on the newest guidelines from the ASRM. what criteria are we looking for to resume embryo transfers as a result of COVID-19? As physicians, we all took an oath to do no harm. I think that is the simplest answer to this question. We need to make sure that our clinics, our patients, and the greater society is ready for patients attempting to achieve pregnancy through assisted reproductive technologies, or ART. At this time, we just don't know. Again, when these guidelines come out, that'll help guide us. But of course, CCRM is always focused on using the best data that is out there. Therefore, we're going to have an internal conversation with the doctors all across the country. We're going to talk to Dr. Schoolcraft, our founding physician, and together we're going to make a plan where we think that we have the lowest risks possible to help our patients achieve the best outcomes possible. So stay tuned on these key questions, but let's take a look at what else you guys would like to know. With respect to getting started, a patient here wrote, "I'd like to get started as CCRM. What do I need to do and when can it happen?" This is a loaded question. CCRM is definitely not known as one of the fastest clinics to start treatment, although paradoxically, we probably have one of the fastest times to pregnancy. What I mean by that is that for our patients in our network, we have a very well-structured program where we do significant diagnostic evaluations to make sure that we are setting our patients up for the most successful cycle possible. What the ASRM guidelines don't say, and what our clinic is not saying, is that we can't see you. We want to see you, we want to talk to you, and we want to set you up for a successful cycle. What that means is that we are scheduling patients, and you can call 1-877-201-6931 to schedule an appointment with a physician, either in person or by telehealth. You can also go to our website, as you can find the link below. But our goal is to help set you up so that when we feel it is safe, we're going to hit the ground running and you're going to get the best cycle possible. What that involves is making sure that we have diagnostic information on our female partners, which includes getting ultrasounds done, cavity assessments to making sure that uteruses are normal, and also doing an evaluation of the hormone profiles and baseline blood works which are required. For men, this means making sure that we have blood work done as well as getting a semen analysis, or making sure that the semen counts are normal for all the parameters that we need to see. Most importantly, there are inherent delays in any cycle start, which means that we need to make sure that our checklists are complete. Before we give a patient a calendar, we need to make sure that we have information about their genetic carrier screening, their infectious disease, and the other parameters that I mentioned before. All these things can and should and will be done even during this time of pause. So as soon as we can start, we will start, and we want to help you as quickly as possible. We have a question up here on the computer. Someone just emailed in asking, during this delay, what can I do to set myself up to have the best cycle possible? So I love this question, because this question to me is what I call the silver lining regarding the ASRM guidelines. If there's anything positive about COVID-19 and the ASRM guidelines, what they tell us is that during this pause, patients have an opportunity to do something, and that something is to improve their diet. There's great research that has shown that by adopting a diet similar to the Mediterranean diet, that patients can improve their fertility outcomes. In fact, in patients less than 35, there's a recent Greek study that showed that the conception rate and the live birth rate was 2.5 times that of the population that did not adopt the diet. So, using this time where we're all taking a pause and many patients are doing their workup and their evaluation, you can use this to help get a better diet. In fact, we know that for men, if you improve their diet, you can improve their semen parameters. We know that if you get vitamin D at a normal level for both men and women, you can improve egg and sperm quality. And one of the best ways to improve your vitamin D is by getting outside. Of course, if you're socially distancing, this means that you can just walk alone or with your significant other that you're living with. But most importantly, it means that you can take this time that you now have, because most of us are working from home. Of course, I'm here in the office working from here, but many of you are working from home. And if you're working from home, you can use this time to plan the best meals possible. Meal planning becomes an activity. Shopping for food online becomes an activity. Delegation of cooking and the cooking itself becomes an activity. And of course, now that you have this extra time in your schedule, you can enjoy the meal that you've cooked. Look at this extra time and this pause as your opportunity to set yourself up for the best success possible. Many of you who are CCRM patients already know, or for those of you who have done research about CCRM know, we are big advocates of optimizing your body prior to starting a cycle. We have treatments such as acai berry or other antioxidants or vitamins that we recommend for our patients. And if this is something that interests you, I recommend that you reach out to your provider or schedule an appointment with us, and we can help educate you about what you can do to make the best of this opportunity to have the best cycle possible. A patient asked us, quote, "I am 7 weeks pregnant and I work in healthcare. Is it dangerous for me to work?" As far as we know, there is no teratogenicity or adverse effects of COVID-19 on pregnancy. With that said, what we are doing is using the data that we have from SARS and MERS, two very similar infections, to advise our patients and providers that pregnancy in the first trimester is relatively safe in the face of a COVID-19 pandemic. However, there's still a lot to be learned. We do know that an elevated temperature in pregnancy can be problematic. Therefore, if you do have a fever, make sure you treat it with Tylenol. Second of all, we do know that right now, anyone who's having a COVID-19 infection in their pregnancy, that data will not be acquired and we won't be able to say the effect of it until later in the year, closer to the end of the fall, early winter. Therefore, use common sense. Wash your hands for at least 20 seconds, socially distance. If you're a healthcare provider, please wear both eye and mouth face protection. If you go to a CCRM, you may see that we're wearing masks when we see patients, we're wearing goggles when we see patients, and take every precaution that you can to help protect you and your growing family from the risks of COVID-19. Another question: what is the best way to keep the body ready for when this is all over? Well, I think we spoke before about optimizing your diet and optimizing your body through vitamins. But one of the other things that's important to say is that just because gyms are closed doesn't mean you can't exercise. It's long been known that stress can have a significant negative impact on the quality of cycles and the ability to get pregnant. So, just as much as cooking can become an activity and vitamins can become part of your daily routine, we do recommend that you make the every best effort to schedule exercise as part of your daily routine. That might mean going outside for a walk and making your work-related calls on your cell phone. That might mean competing with your friends online and creating a community where you try to see who can calculate or acquire more steps. Whatever you can do to increase your activity will help manage your stress. It'll be better for your metabolism. Again, you might increase your vitamin D levels if you're fortunate enough to live in a sunny environment. But just remember, when you're outside during this time of unknown, please make sure that you're socially distancing and that you're limiting all of your chances of having an unanticipated exposure to someone who might be carrying COVID-19 and expose you. Two last questions. If you skip an IUI cycle after the first, do your chances go back down to the 10% instead of increasing? So this is a great question. What happens if you don't get pregnant from your first cycle and now COVID hits you in your second cycle? How do we counsel you about your chances of success? Well, we always counsel patients that the best predictor of the future is the past. So of course, if you've had unsuccessful cycles in the past, something needs to change. However, we don't have all of the tools right now to be able to offer you the best chances. So what I would say is talk to your provider about what is the lowest risk intervention that you can do to help protect you, your future growing family, and your partners from having an untoward outcome, but at the highest chance of success possible. In our approach here at CCRM New York, right now we're telling patients, hold tight. Next week, we will get guidelines from the ASRM, and we're going to reach out to our patients who have what we call the pending cycles, the cycles that were just about to start before the guidelines came out, or the cycles that were already started that we had to stop as a result of these guidelines. And what we're going to do is talk to our patients to say, this is your data to date. This is where we stand today. Let's make a plan to help you achieve your goal. It's important for all of you out there to know that your success is our success. We don't stay open without patients coming through our doors. We know patients have trusted CCRM for more than 20 years because of the outcomes that we're able to provide them. Our goal is to have the safest and the best outcomes possible. And of course, during this time of unknown, the last thing that we want to be able to do is to say to you, we don't know. Because unfortunately, there's just not enough data out there, but we just don't want to tell you we don't know the risks and then I'll have you assume those risks. So instead, when we're not sure about what's going on with COVID just yet, we're taking this time to set you up and set ourselves up to have the best outcomes possible. Lastly, how long should someone wait to try after having a negative pregnancy test? Well, again, right now, we're just not sure with what's going on in the world. Having a negative pregnancy test is a truly negative event in someone's life. In fact, I often counsel my patients that a negative pregnancy test needs to be mourned because there's so much excitement and anticipation that happens prior to that test. With that said, during this time, we know that a negative pregnancy test also just seems doubly devastating because nothing is positive as it seems on the news right now or on social media, and then there's this very personal event that happens with a negative outcome. All of us in the CCRM network endorse and support mental health. If you feel that the stress of what you're going through right now may be from COVID-19, grappling or battling with the diagnosis of infertility, having your cycle paused, or just the inability to proceed when it feels like your age is continuing, but the cycles cannot, we recommend that you reach out to your provider and ask for resources. Every clinic and every provider has a network of resources to help our patients feel the best during this time of unrest. I want you to know that on behalf of CCRM New York and the rest of the physicians in the network, we want you to succeed. Your success is our success, and we want you to be safe. So please keep the questions coming. Thank you so much to all of you for watching our first installment of CCRM TV, and we look forward to seeing you here at CCRM New York and the other locations around the country in the very near future. Please stay safe.